Hello, my name is Vicki McGill, and this short video presentation is on cardiovascular disease that can lead to an MI, which is myocardial infarction, most commonly known as a heart attack. Right now in the United States, cardiovascular disease is the #1 killer of both men and women. This video would ideally be watched at the beginning of a class in a classroom setting, and it's geared towards nursing students at either at the senior level or graduating level of any of the nursing programs, either LVN, ADN, or BSN. Nursing graduates are going to encounter patients that are experiencing signs and symptoms of an MI or that do already have cardiovascular disease. There are two overall objectives. The first overall objective is for the students to develop an understanding of the pathophysiology of cardiovascular disease and how that can lead to an MI. The second overall objective is for these students to gain knowledge of the lifestyle changes patients with cardiovascular disease can make in order to prevent an MI from occurring. There are also 3 specific student objectives as well. At the end of this video presentation, the students will be expected to create a dialogue with their simulated patient explaining how cardiovascular disease can lead to an MI. Secondly, they will be expected to contrast the differences between the usually experienced signs and symptoms of an MI between both males and females. Thirdly, the student will be expected to design a lifestyle improvement plan for their simulated patient to prevent an MI from occurring in the future. The essential pathophysiology of cardiovascular disease is simply there is plaque or fatty buildup or atherosclerotic buildup in the blood vessels of the patient's body. This plaque will narrow the arteries, and especially the 2 coronary arteries and their branches that feed the heart muscle. This plaque can so narrow the blood vessels or the arteries to the heart that they are completely occluded, or the plaque can break up, causing a clot or a thrombus to form, and this can also clog or clot or occlude the arteries, damaging the heart muscle. The typical signs and symptoms of a heart attack is usually chest pain that may or may not radiate to the left arm or the right arm, to the jaw, to the back. There's also generally some diaphoresis or sweating. There's usually some shortness of breath as well. And there can be dizziness or lightheadedness as well. This is mostly true for males that experience an MI. For women, they can have symptoms as far as a year in advance of actually having a heart attack. These symptoms that can go on for a year include indigestion, difficulty sleeping, unusual fatigue, shortness of breath, especially for Black women, unusually or very high anxiety, and chest pressure. Many a time, these symptoms go ignored. When the women present in the emergency room or to their healthcare provider, a lot of times they are saying that they're having the worst case of heartburn or indigestion ever, or they're experiencing some vague symptoms that they may not even be able to completely describe, or some chest tightness or fullness or pressure. Righty. There are several changeable risk factors that anyone with cardiovascular disease can change and that can make differences in their lifestyles in order to prevent an MI from occurring. These risk factors are obesity, diets that are very high in fat content and sodium content, sedentary lifestyles, unusually high stress, smoking, and inadequate sleep. It's recommended that most adults get at least a minimum of 7 hours of sleep per night. The reading material for this lecture would be both the pocket companion to Robbins and Cotran, Pathologic Basis of Disease. Those pages are 353 to 358. Also the textbook by Guyton and Hall, the textbook of medical physiology, and those chapters are 14, 15, 20, 21, and 22. Ideally, this reading should have been done prior to hearing the lecture. The learning activity involved with this is the role playing. The students would be given about 15 minutes in order to decide which student's going to play the nurse, which student is going to play the patient, exactly what signs and symptoms they're going to simulate, get their plan together. Then there would be about 10 to 15 minutes allowed for the actual role playing to occur. They'd also be given a rubric with detailed expectations. And after their role playing was completed, their peers would be asked to discuss what they thought of the job that both participants did, and also to add or to delete any possible information or things that they thought should have been included or excluded. Hopefully, this lecture will cover and test the students' understanding of the pathology of cardiovascular disease that can lead to an MI. It will hopefully cover the lifestyle changes to reduce risks for the development of MIs. And hopefully it will also be contrasting the signs and symptoms associated with both male and female patients that undergo these signs and symptoms. Thank you.